You didn't choose medicine, but medicine chose you in this way.
So I think it's a calling. More than a job, it's a calling.
Yeah. What exactly cancer is and how it develops in the body.
There are more than 200 types of cancers.
Why some people get cancer and some people do not get cancer.
Food is really important. I always say, you are what you eat.
You don't always catch an illness because of a virus or a bacteria. But the way you live your life, the habits you have, and the things you do have a major impact in your life. Yes, we are talking about lifestyle diseases and more importantly cancer, which is a worldwide killer. Joining our discussion today is Dr. Chinnababu, Surgical Oncologist and Clinical Director from Yashoda Hospitals, Hitech City. Welcome to the program, Doctor, and it's so good to have you back here again.
Thank you so much. My pleasure.
So, Doctor, with more than 2 decades of experience in surgical oncology and performing surgeries on more than 20,000 patients, so tell us a bit about your medical journey and what made you choose this field.
Well, Dr. Lakshmi, if I had to get back into my nostalgia, well, becoming a doctor was not even in the remote corners of thoughts in my parents' mind or in my mind. Just I would say a divine provision that I had to kind of get through this journey, and I believe that it was destined. I was destined to become a doctor, more so a cancer surgeon. So I believe in that, and probably if I look back in my village, nobody ever ventured into higher education. So in that sense, the provision was given to me. So I would always say there is a constant pull and push and a pat from people around you. So that actually helped me to become a doctor, because to be able to give hope and to be able to really bring smile in the lives of people who are dealing with this disease of cancer, I think that's a privilege.
So I think you didn't choose medicine, but medicine chose you in this way.
Probably, I think the purpose, I always call the purpose of life, right? So the calling.
Yeah.
So I think it's a calling. More than a job, it's a calling.
Yeah. So we are here to talk about cancer. And I'm sure when we say cancer, it is related to fear, uncertainty. And I'm sure that many people do not know what cancer means. Would you like to explain to our audience what exactly cancer is and how it develops in the body and how it affects us?
No, sure. I think the word cancer, as you rightly said, it's a depiction of fear. Now, many people actually come to my OPD and they think as if I give them a deadline to live.
Yeah.
Right? So that's the kind of fear people have with that word. What comes to their mind, your mind when you think of cancer is, loss of hair, right, grotesque appearance, some kind of, negative image.
Yeah.
But coming back to, in essence, what cancer is, if you look at, I think it is not just one disease, it's a, complex disease. There are more than 200 types of cancers. But to define what cancer is, it's basically the division of cells in the body has gone haywire.
Yeah.
So the multiplication happens without any control.
So the cells keep growing.
They don't stop dividing.
Yeah.
I would rather say it as failure of traffic signals. Right? So instead of go, it says stop. Or instead of stop, it says go. So what will happen? There will be a traffic jam. So it will stop.
Yeah.
Right? The triggers could be various, in terms of the lifestyle, in terms of carcinogens, what we call as exposure to all of them. So there are all multiple triggers at different points of time, and then it leads to the unregulated division of cells.
But previously we have seen that cancer was only associated with elderly people. But now we are seeing a very disturbing trend, especially in our country as well, where young people and also, where children are affected by cancer. So what are your thoughts on this? I mean, why do you think that this trend has changed what was there earlier?
No, definitely you're right in terms of the age shift for cancer occurrence, especially compared to the West. In India, we see cancer a decade earlier. So there is a age shift, definitely, but more importantly, why does it happen so, and what is the reason for it? I think one of the significant causes that I think of is there is a change in the lifestyle. Better technology we have today, we have changes in the lifestyle, and also longevity is increasing. Thus, I think putting together all of this, the overall incidence of cancer is increasing. I would rather say India is going to be the cancer capital of the world very soon.
It is already a diabetes capital of the world.
Yeah, it is. See, today the food that you eat, the air that you breathe is all contaminated. Added to that, your own personal choices of lifestyle, right? May it be tobacco chewing, may it be tobacco smoking, right? May it be lack of physical activity, right? So in that way, I think unhealthy diet is contributing significantly. So putting together all of this, it's a complex, not one factor alone can lead to, but all this put together, I think that's where we see that India is facing a big problem.
So I think you stressed a lot enough about lifestyle diseases.
Yes.
So what do you mean when you say that a lot has changed, the lifestyle has changed, and also if we have to talk about modifiable risk factors?
Yes.
So because we do not know why some people get cancer and some people do not get cancer. So how would you like to explain this?
Yeah, I think coming back to your question of risk factors and why you see cancer incidence so high and what are the modifiable risk factors. So I always say one important formula called 4-4-80. 4 stands for 4 modifiable risk factors, which lead to 4 non-communicable diseases, accounting for 80% of the deaths. So what are those 4 modifiable risk factors? Number 1, tobacco. Consumption of tobacco in any form. Right, not just smoking, but even chewing. Number 2 is unhealthy diet, which we discussed before. Right. Number 3 is lack of physical activity. Right, and number 4 is excess consumption of alcohol. This can lead to diabetes, cancer, cardiac disease, and respiratory conditions. So in that way, I think overall today we are moving towards a condition wherein actually we are harming our own health.
Most of us, we stress a lot on tobacco and alcohol, and less about diet and physical activity.
Right.
But very less about diet and physical activity. No one stresses much on these, which is actually needed.
Correct.
Yeah.
And I totally agree with you because food is really important. I always say, you are what you eat.
Yeah.
I think the good old mantra, what was there, I think, getting back to that really helps us to have good health.
Yeah. And that's the same thing what we are following with fancy terms.
Yeah.
Exactly. So I think it's more like, your genes or genetics, they load the gun, but your lifestyle choices, they pull the trigger.
Yep.
We have to put it together.
Yeah, you said it right.
Yeah. And then coming to another important aspect is genetics or genes. Right. So do you think that if any cancer is running in the family and the next generation is definitely going to get that, or is there any way that we could prevent that?
Well, I think there are 2 aspects to the genetic aspect. One is, is cancer a genetic disease? Yes. Because unless there is a change in the gene, cancer cannot happen. In that sense, it's genetic. But running in the family is what you're talking about. It talks about hereditary cancer, right? So hereditary cancers basically, if it, for example, we have all heard about Angelina Jolie effect. She was diagnosed to have BRCA gene mutation. So she underwent a prophylactic breast cancer surgery, and she also underwent prophylactic oophorectomy for prevention of ovarian cancer. So that's because in her family, her mother, her aunt had this ovarian cancer, and the BRCA gene was positive in their family. That's why she underwent a prophylactic surgery.
Yeah.
So given that if in a particular family this BRCA gene is positive, then we discuss the options of risk reduction strategies. Right. Other than that, overall, I think for the common public, hereditary cancers need not be a big concern in that sense, because if you look at the total number of cases, about 5 to 10% only are hereditary.
Yeah. And the rest all are...
The rest is all sporadic.
Yeah.
About 70%, I would say, of them is environment and, the lifestyles.
Are there any preventive measures that we can take apart from screening, which is very important, I believe? And what are the preventive measures that you would like to...
Yeah, prevention, I think we all know is better than cure, right? So, how do you prevent cancer? Can we totally make sure cancer is not going to occur at all? Absolute prevention is not possible, right? But majority of the cancers, for example, cervical cancer, in our lifetime we can prevent cervical cancer.
Yeah.
Because we know the cause. We have a simple vaccine. So there are 2 vaccines to prevent 2 cancers. Hepatitis B virus vaccine and human papillomavirus vaccine for cervical cancer. So 2 cancers can be taken care of if we take 2 vaccines. So other than that, what else can we do to prevent cancer? Probably, I think change in lifestyle is number 1. I think, physical activity, right? Healthy diet, right? Consumption of more fruits and vegetables, right? So all this modification of our lifestyle.
So what screening methods that you would recommend for us to follow, especially after you hit a certain age?
I think screening is very essential thing, not to prevent cancer, but to detect cancer very, very early, even before you have symptoms. So in that way, it could be one of the prevention strategies, because we are detecting something which did not manifest or which is not going to manifest in the near future. Right. So given that, I think based on the age group, for example, any women above 40 years of age, get an annual mammogram, an X-ray of the breast for breast cancer screening. Okay, and then monthly once you can do a self-examination. Be self-aware of your breast. Note for any changes. So similarly for cervical cancer, we have pap smear after the age of 35. Right, from 20 to 35, we can do pap smear once every 3 years. If we do HPV testing, the human papillomavirus testing, we can do once in 5 years. So similarly for men, we have prostate, we have a tumor marker called PSA. So above 50 years of age, get simple serum PSA done. Right. So like that, for most common cancer, screening is not for every type of cancer. So if you are above 50, get a colonoscopy done once every 10 years.
Okay.
So if it is normal, you don't have to worry for the next 10 years. So in that way, I think, screening does help in saving lives. Mammography has proven to save lives. So I think I strongly recommend to all our viewers to consider cancer screening as part of their health checkups.
But do you think that most of the patients, what you have seen about awareness, do you think that they believe about screening, or how do you see that this trend has changed, especially in your 2 decades of your clinical experience?
No, I think the question is very relevant. I don't see any change because there's not big take. The screening for cervical cancer is not even 2% in rural area, not even 5% in urban area. Even for breast cancer, less than 5%. So even the educated are illiterate in that sense.
Correct.
So in that way, I have not seen any significant alteration in the trend for screening and adoption of screening. It's not picked up. I think we need to sensitize the communities at large. I think a programs like this, what we're doing, I think this will go a long way in communicating the right message.
Correct.
Not to cause fear,
Yeah.
but to make them well informed and take a right decision.
Yeah. Should be aware of, because cancer is totally preventable, and if detected at an early stage,
I would say majority is preventable.
Yeah.
Yeah.
Correct.
Yeah.
And detection at an early stage is also of paramount importance.
Absolutely. The outcomes of cancer treatment depends on the stage. Early detection helps in cure.
Yeah.
One statement I want to make here, Lakshmi, here is because people always compare the results in the West. The cancer treatment is very good in the West. Outcomes are extremely good. Honestly, the majority of the results are good there because most of the cancers in the West are detected in early stage. 70 to 80% early stage detection happens in the West. It is just the reverse in India. 70 to 80% we see in stage 3, stage 4.
Oh,
that's why we don't have good results, and we think that maybe we are not managing well, or we don't have a best infrastructure to manage or equipment to manage. India has the best infrastructure healthcare wise. The capacity is wonderful. We have the excellent doctors. See, today the cancer care is universally same in that sense. Okay. The access to the best of the best medicines, the best of the best technology. See, for example, we have MR Linac.
Yeah.
Right. We have the latest robot, Da Vinci X, Yashoda. Right. So this is possible, and it is available, and so at far and at much less cost. Right. So in that way, a low cost, accessible, world class care is available today. So I think the most important thing that I want to convey is that early detection is very much essential, and people should come forward for screening and get it detected very early.
So before we wrap this episode, Doctor, is there any message that you would like to share with our audience?
I think the message is very clear. Cancer is not a death sentence. Cancer is curable. If we detect cancer early, we can completely cure the disease in majority of the cases. So eat healthy, make your life choices very, very clear in terms of physical activity. The modifiable risk factors, physical activity, less consumption of alcohol, have a healthy diet, and avoid tobacco. I think if we can do this, you're doing a lot of good, not only to yourself, but to the nation at large.
So thank you, Dr. Chinnababu. It was wonderful having you here on our program today.